of the most recent statistics available show that birthing Black women in California die at 6 times the rate of white women. 6 times the rate. Black women from all segments of society complain of not being taken seriously when they interact with the healthcare system throughout their pregnancies, and they point to racial bias as the reason. It's something superstars like Serena Williams have said that they've experienced. If someone like that with access to all of the advantages says she almost lost her life because of such bias, what's being done for other women in her situation? Sarah Diaz, the policy coordinator for California's WIC Association, with me now live to explain how efforts to expand the Federal Momnibus Act may help. Welcome to Fox 40 News at 11.
Thanks for having me.
Definitely. First, Sarah, a lot of people have heard of WIC. It's a program that supports 6.4 million mothers and young children across the country. But someone listening right now may not understand how it does that. So please go ahead and give us a little overview and why WIC is behind this renewed Momnibus effort.
Sure. So I can give you WIC in a nutshell. Like you mentioned, 6 million people nationally, about 1 million of whom are in California. And WIC is a national nutrition program, sort of similar to a program like SNAP or CalFresh here in California. But unlike SNAP or CalFresh, it focuses on a more specific group of people. So to participate in WIC, you need to be either pregnant, breastfeeding, or chest feeding if you're an adult. And then it also serves infants and children up through the age of 5. And also, unlike SNAP, it provides a more specific food package. So healthy foods that are designed to meet the nutritional needs of our expecting parents and then our infants and children. So for babies, we have infant formula if they're not receiving human milk and baby food. And then for the older kids and adults, it would be things like fruits and vegetables and whole wheat products and high protein foods like beans and peanut butter and, dairy, stuff like that. And WIC is ultimately a public health program, and we see improved health outcomes for our WIC families, and we want all families to have improved health outcomes and to thrive. And so it makes sense to focus on the groups that are, at more risk. And, we see an emergency with maternal mortality, and we see an emergency particularly among Black women. As you mentioned, they're 6 times more likely to die. And so we want to make sure that Black families in California and throughout the country have access to all the support and interventions that we can muster in WIC and in health policy. And there are a few WIC-specific provisions within the Momnibus Act, and one of those would be to expand postpartum coverage for 2 years. Right now, it's 6 months for parents who are not breastfeeding and 1 year for parents who are breastfeeding or chest feeding. So this would expand the program for 2 years after giving birth for parents, and it would also provide for some anti-racism and implicit bias training for WIC staff. WIC staff, local agency staff in California, I want to give them a shout out.
Let me just stop you for a second, since you brought up WIC staff. We hear terms like implicit bias training in a lot of conversations about police departments, but the update to the Momnibus Act would include training to create a more culturally competent workforce at WIC. So your organization is really looking at itself. Has any specific research revealed an issue, or do you just see that as something preventative and therefore necessary?
Not sure about research, but I can say that there has been some, I think there have been some surveys of participants in the past several years. And like I said, I think our WIC staff are very passionate and they care deeply about WIC families and their communities. But we do know that Black families don't always feel like they have full access to the program, or they don't always feel the most welcome and included. And we want to change that. Like I said, we want to focus our efforts where the highest risk and the most emergent situations are. And so I think making sure that our WIC staff are culturally competent and they recognize that, intervention is needed for Black families, and making sure that our Black families are as healthy as possible and receiving the referrals that they need to other services outside of WIC, and that they're served to the best of our ability. We want to celebrate our local agency staff, but we always think there's room for improvement, and we're looking forward to that.
Definitely. The Wise Investment in Our Children, or aptly named WIC Act, was just reintroduced in Congress, and part of this would kind of bridge a gap to make sure kids have access to affordable, healthy meals until they can connect with free meals at school. What's been happening in the absence of that kind of bridge?
So we do know that there's a food security gap of about a year for some kids, because the the kindergarten enrollment birthday cutoff date is September 1st. And so if your birthday is on September 3rd, your child's birthday is on September 3rd, they age out of WIC when they turn 5, but they aren't able to enroll in kindergarten that year. So they could go a year between when they're receiving WIC benefits and when they are receiving school meals. And we do know there has been some research that's come out about school readiness and early literacy scores, and pointed to that food security gap, that kids that don't have WIC and also don't have access to school meals are scoring lower. And I think that those early literacy scores and school readiness scores are less of a problem than the hunger itself that they point to. We want to make sure that our families have as much access to as much healthy food as possible, and we want to shore up that food security gap.
All righty. Thank you so much, Sarah Diaz, for coming in from the California WIC Association to tell us about all those moves that are underway to try to do just what you said. We appreciate you.
Thank you for having me.